Hello, I'm Dr. Clint Sexton. Today I want to talk about migraines. And we have this new approach of how we look at them. So over the years, and if you look at the research, you keep running into three different chemicals that really seem to be a factor in the creation of a migraine. So one would be estrogen. Okay, so we're talking about a hormone. Another would be serotonin. So now we're talking about what's called a neurotransmitter, or a chemical made by nerves. And then we would be talking about histamine. So histamine is a chemical of the immune system. And we've now just basically covered the three major regulating systems of your body. So you'd have the nervous system, we'd get serotonin from that. We would have the endocrine system, which is the hormone system, and that would be estrogen. And then we have the immune system, and from there we would get histamine. These all influence each other, and that's the other thing that makes these unique. Changes in estrogen will change how serotonin will work. Changes in the estrogen will change the immune system, which will change how histamine is going to affect the body. Okay, and so you can just see these interconnections between these three chemicals. And when you start looking at a lot of the medications that are used to manage migraines, you know, some of them they're addressing just serotonin, or they're not really doing much with hormones, but we know the impact of hormones and how that can influence migraines. That's another reason that women are much more likely to suffer from migraines, is because of that hormonal component. And then we have the immune system, and they're really not doing much with the immune system, at least from a histamine perspective, but they are using, medications that work with reducing inflammation. But we want to get to the problem before it gets into a state of inflammation, okay? So you have these three chemicals, and they're essentially going to impact two structures inside of your head. One would be the blood vessels. When we think about migraine, so a migraine is technically a blood vessel related headache. We know a lot more about it now. It's not just a matter of the blood vessels getting small and getting large, and then getting small, and how this contributes to pain. There's a lot of other chemistry involved in it, but essentially it's a blood vessel related headache. Then we talk about the nerve that conveys those pain signals. So you have a nerve called the trigeminal nerve. You have two of them. And the trigeminal nerve actually is what puts the nerve endings go to these blood vessels. So as these blood vessels are affected, you're able to perceive the pain and discomfort associated with it because of this nerve carrying those signals. Now, these same three chemicals I was talking about, estrogen and histamine and serotonin, are going to influence not only what the blood vessels are doing, but also the trigeminal nerve and how that's going to convey pain. So really what we're doing is we're really looking at the key fundamental chemicals that have been associated with the triggering of migraine, and we're putting these together and seeing how they affect each other so we can get more balance to the system. And if we can get greater balance to those chemicals, you bring you down below this threshold of triggering that migraine. Okay, so hope you found this interesting. If you want more details and specifics and some studies, check out the blog.